So Dr. Bales, you know, one of the things that we've learned over the last couple of years with these interviews is that mammograms not necessarily the best way to detect breast cancer. There's other ways that are much better, that are superior, and one of them is thermography. You're going to demonstrate a thermographic machine for us today and talk about that.
I will. My father actually invented the first all-digital infrared camera in 1979.
Wow.
But it wasn't for anything with body or health. It was actually for our defense. It was used in missile detection back in Afghanistan.
So it was looking for heat.
It was looking for heat for missiles. It used to be you had to track the missiles going across the sky manually. Now in our warheads we have that does automatically. In the early 80s, a group of doctors approached my father and said, you know, we've heard that the body obviously has circulation, and we can diagnose a lot of diseases by seeing where there's hot spots or where there's cold. And he said, okay, I'll make a medical version for you.
And he really, that is fascinating. But the first one was missile detection.
First was missile detection. Yeah.
Awesome.
Yeah. Basically, it can be used in any part of the body. Probably, as most people have heard, the breast thermography is the most popular. It's really limited as far as cancer to breast, possibly some skin cancer because it is skin deep. It doesn't look like for liver or their organs, but it's a great way. It's completely painless. The ladies like it because there's no pancake smasher, as they say.
Right.
There's no ionizing radiation, so it can be done as little or as often as one wants. It's just in a cooled room that it's performed.
Okay, great.
So here on the screen, I've pulled up a couple examples. So on the left here, we'd see this woman, we would say, is very low risk for acquiring breast cancer because there's not a lot of, as you can see, the red or that around the breast tissue. She does have some red up in these areas. That means she's alive. That's her carotid and jugular.
Okay.
So we'd hope we'd have a little bit of circulation there.
Right.
As opposed to this image here on the right, where you can see there's quite a lot of activity. Now, thermography is not a diagnostic, so it can't say you have cancer or you have this. It's just a screening. So after this, we would do one of many things, either watch the patient, have them in for a recall, this being their baseline, or perhaps to go on to an MRI. You mentioned some of the limitations. There's been at least 2 studies, very large, that have come out on the limitations of mammography. One of them was a Canadian study, I believe it was 20 or 25 years that they've watched in the past, that found no benefit. Also The Lancet, which is a large British journal, equivalent to our Journal of American Medical Association, or JAMA, came out and said that there's really no benefit at all to doing, and possibly some harm. The harm being it is ionizing radiation, which we know isn't the best for us.
Right.
And also, again, with the pancake smasher, if you do have a cancer and you smash that wall that the body's put around it, are you spreading the disease that way?
Right.
I don't know, but I don't want to find out.
Well, yeah, and that's the Lancet, right? That's pretty reputable.
Exactly. Yeah, it's pretty reputable. And also the BMJ, the British Medical Journal, I believe, did a write-up as well. So that's 2 or 3 very reputable, internationally published articles.
Hi, this is Ty Bollinger. Thanks for watching. If you want to know the truth about cancer, click the link in the description below to watch our award-winning docuseries, The Truth About Cancer, A Global Quest.